Nose bleeding, epistaxis. Health is very important to improve the community's well-being, and one of the problems that may person or parents face during the summer season or serious health problem is nose bleeding that called epistaxis. Anatomy and function of the nose parts. We have bones that support the nose and its heart that give the nose its shape, the blood vessels that in the nasal cavity nourish the nose parts and do their function. We have hair and cilia that are located inside the nose that cause protection of the inside nose areas from dirt and harmful particles. Also, the sinuses are located in the nasal cavity to produce mucus for the nose to keep the nose moist. We have nerve cells are responsible of contact with the brain when smelling and smell the signal will go to the brain to identify the source of the smell. So nosebleed also we can call epistaxis appeared because of the damage or rupture of the nasal cavity blood vessels. This can be in children, adults, and pregnant ladies because of there is many reasons that were we have the dry the nose surface because of the dry climate there is heat or there is extreme cold. There is some diseases of the blood vessels like increased blood pressure that can cause rupture of the blood vessels, and there is some types of tumors, and also the hereditary can cause nosebleed if there is a hard object that injured the nose, and there is type of medications that cause the nasal to be dry and bleed. Rubbing the nose frequently with blowing the nose, this can cause bleeding for the nose. Also, some types of infection, like flu or respiratory infection, can cause nose bleeding. The emergency management of nosebleeds at home. At home, the person or parents must identify how to manage a nosebleed and must not be kept for a long time that may cause the person to lose blood and faint. So we will ask the patient to sit down and tilt the patient head forward to allow the blood to flow forward. Let patient breathe from his mouth and his nose. Pinch the upper part of the nose. Advise the patient to avoid speaking, swallowing, coughing, and sniffing. Give clothes or tissues to move nose dribbling. Place cold packs on the nose. If all the procedure were done and the bleeding is still not stopped, you must take the patient to the nearest hospital. The prevention of nosebleed. Nose bleeding can cause serious problems for some people, so the prevent recurrent nose bleeding that person can do what? First, use saline nasal spray or nasal gel that lubricate the nasal cavity and protect from dryness. We have the humidifier. We can use it in the bedroom, especially at night. That helps to lubricate the nose. Avoid forcefully blowing the nose when sneezing and playing with your nose and putting any hard object or your finger in the nose. Also, we can modify or identify the medication that cause nosebleed and take advice from doctor. Lastly, protect your face when playing or doing exercise or in the extreme heat or cold that cause dryness or of nasal cavity or injured it. Thank you very much, and if you like my videos, please put like and subscribe to have new videos about health. And if you want to know about uh, about the nosebleed and know more, you can read my blog page. And also, if you want the Arabic version of the nosebleed, please you can follow me in the Instagram. Thank you very much.